Give everyone a second to join. Okay.
Good afternoon, everyone. Welcome to the iQuery Technical Assistance session. This is another one of the sessions in the IPLAN training webinar series made possible with funding from the Illinois Department of Public Health and the Community Health Assessment and Planning Grant. Happy to have you here today. We are recording this session, so if you want to share it with some colleagues, we'll be sending it out to those of you who registered after the session. My name's Laurie Call, and I'm the director of the Center for Community Capacity Development at the Illinois Public Health Institute. I'm joined by my colleague Samantha Lasky, and today you will hear from 3 IDPH staff: Joanne Bardwell, the IPLAN administrator, Dr. Frida Folcom, the Health Statistics Division of Health Data and Policy, and Anna Sakic, the Health Data Specialist in the Division of Health Data and Policy. Thank you to them for being here today and putting together this demonstration. So we've got a few Zoom polls that we'd like to ask to get things started. So if you're not at your computer or phone, if you could tune in really quick. First question is going to be popped up on your screen for a poll. And the question is, how much experience do you have with iQuery? It's maybe new to some of you. It has been not updated for a while, but we've got great news for you today. So the answer responses are none, some, are expert. And so let's see, how many do we have answered here?
We've got about 68% answered.
Okay. Well, let's go ahead and see what those answers are.
Okay.
All
It
right.
looks
50-50. Is that right, Samantha?
Yep, between none and some.
All right. Well, we hope that you will definitely all leave here with some today and be moving on towards expert. So what have been your biggest challenges with iQuery in the past? Knowing some of you may never have used it, so that's okay. But those of you can write in what have been some of your biggest challenges with iQuery in the past. And we'll give you a couple minutes to do that. Well, let's see what some of those experiences are, Samantha.
We only have about 32% responded.
Oh, okay. Okay.
Yeah, I
well,
think people
give
are still
folks some more
typing.
time. I think there's probably quite a few folks who have not used it before. Biggest challenges with iQuery in the past.
I'll let you
This
know
will
when we get
help
to 50%.
improve iQuery altogether by looking at these challenges and how to overcome them, hopefully. So
We're at about 60% respondents.
since we had about 50% who didn't have any experience, I think we're probably good to report those out.
Okay. So the responses that we're seeing are not having updated data, an awkward query system with outdated data, lots of not updated data, inability for more granular data for some indicators, data suppression. A lot of people were just saying older data, outdated data, making it more friendly and more updated data. That's what we're seeing a lot of.
Okay, great. I think IDPH will be able to respond to many of those concerns in a more favorable fashion. What are you hoping to learn in today's TA session is the last question. So what do you expect or hope to learn today?
Only about 22% have responded so far, so we'll give it another minute.
Okay. No, we've just had a couple people join. If you've just joined, we're just answering a poll question around what do you hope to learn in today's session.
We're at about 48% now.
Anybody else want to answer? All right, let's see what we have, Samantha.
Okay, we're seeing how to better navigate the system, what currently exists or is anticipated for any updates to make it more user friendly or maintaining the most up-to-date data. A lot of folks are saying, I have no experience with iQuery, so anything that you can share with us would be great. Um, how to get most out of iQuery for iPlan, how to best navigate and pull data for our community health assessment. The timeline for Illinois for updating data. Should I proceed with my iPlan with current data or wait for new data? New sources of data and metadata, and how to better utilize iQuery is a lot of what we're seeing today.
Great, great. All right. Well, thank you for that. That's really helpful to give us just a little insight into what you're thinking and hoping for. Today, we're going to let you know how to access iQuery and the web page and all of that, what the features are. Take a look at a demonstration of the iQuery and the dashboard, and go through some data sources, other data sources. Talk about share, and then have some Q&A. So when you leave here today, we hope that you will know the purpose of iQuery. You'll know how to access and navigate iQuery, and then how to navigate the new iQuery dashboard. And we've been using the same group agreements, but the most important thing I want to point out today is that if there are questions or things that come up that we can't address today, we will put them in the parking lot and we'll get back to you with them. We've been sending a follow-up with any answers to questions if we were not able to answer them. And then if they're questions related to iQuery, you'll end up seeing them on the frequently asked questions list on the iQuery website also. So I'm going to turn it over to Joanne Bardwell now, from the IPLAN administrator from IDPH. Joanne?
All right. Good afternoon, everyone. Thank you so much for joining us. Um, we don't take this lightly that for your time. I just want to start off by saying I am so proud of my team. We have listened to your concerns, your inquiries, and all the feedback that you have given us about the current iQuery or the previous iQuery. And so I'm just so excited for this training, and for you all to hear and know what great things are coming in store for this new iQuery modernization site that we have going, that's going to be presented further in depth by Dr. Frida Folcom and Anna Sakic in the next coming slides here. But before we get started, I want to discuss our master data use agreement. So in order to gain access to our new dashboard, IDPH needs to have a master data use agreement for each local health department. And that can be signed off by either your local health department administrator or executive officer. Currently, only one agreement per health department is required. However, multiple users can be added to access the iQuery dashboard with later information on the specifics for that in the upcoming slides provided in this presentation, as well as handouts will be available to you after this training. Currently, we have 80 of our 97 local health departments that have already completed the data use agreement. If you are not aware, if your local health department has already signed this data use agreement, and or if you still have any questions regarding that, the contact person is the division chief, Amanda Fogelman, and the contact information is listed there for her email address. Attached here is an example of what to be looking for. It's the Appendix B, access to public health data acknowledgement. So that's just a little insert. So actually, it's pretty good that we currently have 80 of 97, but we would like to have all 97 local health departments sign this master data use agreement. And so I'm going to hand it off to one of my wonderful colleagues, Dr. Frida Folcom, who was the project coordinator and lead for this IQuery modernization project. So thank you.
Hello, everyone. Thank you for attending this IQuery technical assistance session. My name is Frida Folcom. I'm a health statistician at the Illinois Department of Public Health and coordinator of the IQuery modernization project. So we will now review the purpose of IQuery, preview IQuery web page, describe how to access IQuery. Then my dear colleague Anna Sakich will lead us in navigating the IQuery dashboard. Questions and answers will follow thereafter. So our first question is, what is IQuery? We know that IQuery is the IPLAN community health data system. It is a vital data source for community health needs assessment. You know, IQuery, which stands for Illinois Query, is a web-based, user-centric community health data query system for collecting and disseminating public health data obtained from multiple sources. IQuery is maintained by the Illinois Department of Public Health. Per Illinois law, IQuery is the primary data source to support the comprehensive community health needs assessment process known as IPLAN by local health departments required for their recertification every 5 years. So community health indicators in IQuery are classified based on the 7 IPLAN categories, as Anna will show in the dashboards. Secondly, IQuery serves as a public access health data source. Per Illinois House Bill 2039 of 2024, local health departments need to access public health data for the purpose of preventing or controlling disease, injury, or disability. However, a signed master data use agreement is required to access the IQuery dashboard, as Joanne just presented in the previous slide. So our next question is, where is IQuery? So our next section is, as Joanne said, we need a master data use agreement. And if you don't have an illinois.gov account and wish to use IQuery, please send an email to dph.iquery@illinois.gov. In that email, please include your full name, phone number, email address, and local health department. So once you send that email to dph.illinois.gov, an illinois.gov account authenticated by the Okta will be created by the Department of Information Technology. So the requester will receive an email with a link to finish setting up the illinois.gov account following the steps or directions. Once the email account is created, requester is added to a group in Tableau that can access the IQuery dashboard. If the requester already has an illinois.gov account, they will be given access to IQuery. So that is the step-by-step process on how to get access. And in any local health department, more than one staff can access the IQuery, but we only need one master data use agreement. So now our next question is, we're talking about IQuery. Where is IQuery? So if you want to visit IQuery, go to the Illinois Department of Public Health website, dph.illinois.gov. So at this point, please stick with me as I demonstrate how to get to the IQuery website. So right now, I'm going to try to share my screen.
Great, we can see it.
Okay, you can see my screen. Do you see the happy faces, the smiling faces?
Yes.
Okay, that means you are in the Illinois Department of Public Health, dph.illinois.gov. Once you come to this page with all these smiling faces and happy people, click on Data and Statistics. So once you click on Data and Statistics, scroll down, and then you would see IQuery. So once you click on it, this is the landing page of IQuery. And to be honest, this landing page, this web page was released last night. So you can tell that we've been working behind the scene to make this possible today. And on this landing page, you see that we have different tabs. So we have a tab for IQuery dashboard, which needs a login because we've not suppressed the data, especially for this first issue. And then as you look at the different tabs, they have different, it gives you a little definition of what you will see in each of the tabs. Like you have the dashboard for accessing and visualizing IQuery data. You have the related data, which are additional data from the Illinois Department of Public Health and other reputable organizations that you could use to compile the community health needs assessment. We have a section for indicator metadata, which gives us a detailed descriptions of all the data that is found in the IQuery dashboard. Then we also have a section for frequently asked questions. And if for some reason you have a question, you don't see it in the frequently asked question, please send us an email. And we also have another exciting section which we call share, which means sharing health assessment results electronically. And it's based on all the IPLANs that we've received from for the past 30 years since 1994, and what local health departments say are their main priority health needs. We also have a link to the IPLAN website. As like any public information, we have privacy policy and a disclaimer section. So right now, what I'm going to do is I'm going to go through these different tabs step by step. And so I'll let after I finish, my colleague Anna would walk us through the IQuery dashboard, and then we'll look at the related data and the share during the course of this presentation. For now, let me start with the indicator metadata base. So when you click on that particular link, it takes you to the IQuery metadata, and it gives you a clear definition of, detailed descriptions of all the indicators that are found in the iQuery dashboard based on data source. So we have data from the American Community Survey. We have birth data from birth certificates. We have death data from death certificates. We have data from, we have other demographic indicators. We have data from lead exposure, sexually transmitted. So if you really want to see, let's say, for instance, you want to look at the birth indicators and you want to see how the methods of delivery. So it will give you the detail. You see, I just scroll down a little bit, and then it gives me this column. It gives me the indicator name, which is the method of delivery. It gives a little bit of the description of the number of live births by vaginal, cesarean, or unknown. And then where you can find this indicator in the dashboard is going to be in the maternal and child health indicator section. Note that the dashboard is categorized based on the IPLAN health indicators, and there are 7 of them. Maternal and child health indicator is one of those. And how is the data presented in the dashboard? Is either presented as a percent or as count. So you can see in some instances, you will just see percent. In some instances, you find count. In this instance, we have it as percent and count in the dashboard. So what demographics are available? We have this data is available by age group, by ethnicity, by race, and by sex. So where is the primary source of this data? Because we are secondary data repository. So the primary data source is vital statistics. And what if you need more information about this data? You either call this number 217-785-1064, or you send an email to dph.vitalstats@illinois.gov. And this is what you find for all the indicators that are in the dashboard. So if you want to go back, you can just click this back button and it takes you back to the landing page, iQuery. So we just looked at the indicator metadatabases. So we can also look at the frequently asked questions. If for some reason, this is a very important email, dph.iquery@illinois.gov. If for any reason you have a burning question and the answer cannot be found here, please send us an email, because this page will be updated with users' questions as time goes on. So we have questions that we've put in so far. There are many questions. What is iQuery? Or what are examples of health indicators that can be included in each of the IPLAN health categories? So you see, we have examples of demographic and socioeconomic characteristic. You have data that shows general health and access to care, with examples of such data that can be found in the dashboard. Maternal and child health indicators, we have like live births, low mortality, mothers who smoke during pregnancy. We have mothers who begin infant. We have all this, and some of these we are still working to add some of them into the dashboard. So the dashboard will be growing. Our goal is to update it at least twice a year, at least. So we have chronic disease indicators and examples of chronic diseases, infectious disease indicators. We have environmental, occupational, and injury control indicators. We also have sentinel events like COVID. We even have a help section. So just in case you have a problem, we still want you to contact us for any technical assistance need, or you just send us an email, dph.iquery@illinois.gov. So if I have to go back to to the web page, I can either use the back button or I just scroll back up. And so the other sections, we'll look at the shared later on in this presentation. And then we also have, like any published information or anything that goes to the public, we need to have a section on disclaimer and policy privacy. And, we need to have this section. So you can look at it. But one important section, so in this section, we can say, while the Illinois Department of Public Health makes every effort to post accurate and reliable information, it does not guarantee or warrant that the information on the website is complete, accurate, or up to date. So IDPH assumes no responsibility for using or applying any posted material. So this website is intended solely to electronically provide public with general health related information. So for now, I'll go back, I can still go back to the landing page. And at this point, I'll let my colleague, Anna Sakich, walk us through the dashboard, how to access the iQuery dashboard, which needs a login. Thank you for now.
All right. Hi there. Good morning, everybody. I'll go ahead and share my screen and we can take a look at the new iQuery dashboard that we've created. Can everyone hear me and see my screen okay? All right, excellent. Okay, so once you have executed your data use agreement for your county and you've created a logon and gone through do it and got all that figured out and you've logged in and you have clicked on the link for the iQuery dashboard, this is the new page that you are going to land on.
1 second,
And
Ann, if you don't
yeah.
mind, I'm sorry to interrupt. We see black boxes on the screen. It's probably
thank you.
if you could minimize or just move those.
Thank you so much for reminding me.
No problem.
Totally forgot. Okay, so this is the home page for the iQuery dashboard. And this first button here, IPLAN data, is probably going to be somewhere that you guys are going to spend a lot of time when you're completing your IPLANs. However, I'm going to skip over it for just a moment and I'll circle back to it in a minute. And I want to start here with the LHD profile. So the LHD data profile page is something that we created because we know that a lot of counties don't necessarily have a ton of time or resources to use for their IPLANs. And so we created these LHD profiles as a very fast and straightforward way that local health departments can make comparisons between themselves and the state overall. So I think I'm gonna look at disease indicators first. First thing you'll notice, this first selector here has 7 different IPLAN categories listed. And you might recognize that these 7 categories are the same 7 categories that we ask for data analysis to be broken into in the IPLAN. So we have already kind of organized the data in iQuery to follow along with the way you would likely present it in your IPLAN. And right now it's defaulting to atoms. I'm just gonna go ahead and leave it like that, but all of our counties are available here for this. And I believe, I'm not sure if any of our sub-county areas are on here yet. However, we are in the process of adding sub-county data for almost all of the indicators in iQuery. So that is in progress currently. As you can see with this LHD profile, I clicked on the chronic disease indicators category, and we've got a graph here that shows the trend over time for about the last 10 years or so of deaths by a few different chronic diseases. Cerebrovascular disease, chronic liver disease, chronic lower respiratory disease, heart disease, and cancer. So you could just see at a glance that Adams County generally has kind of a higher rate of death by heart disease than the state of Illinois does. generally speaking. So again, this is just a really quick way to look at these indicators. On occasion, you might have more than one graph come up here. So for the infectious disease indicators, we have a graph for different causes of death that are infectious diseases, COVID and influenza and pneumonia. And we have a graph for cases of sexually transmitted diseases. So this is, the LHD profiles are just a very quick way to, at a glance, see how the county or LHD is trending over time and how that compares to the state overall. Okay, so if you want to go a little bit more in depth with the data than just a 10-year trend, the IPLAN data section is an extremely useful part of this dashboard. So on this home landing page, you'll see, again, we have the data organized by our 7 IPLAN data categories. And then we also have subcategories broken out. So infectious diseases, you can look at causes of death by infectious diseases, or you can look at cases of sexually transmitted infections. You can look at particular years. In this case, we have data up to 2022, so we can look at 2022, and we can look at 2021 and 2022 at the same time if we want to, if we want to compare a couple different years. But let's just do 2022 for now. Geography, we have, this drop down here to narrow it down if you are just looking for maybe one specific geography. But since I have them all selected, all of the geographies that I have data for are listed right here. And that will include the sub-county local health departments. So real quick, we've just right now got a bar graph comparing Illinois, and in this case, it defaulted to Cook County, for deaths by COVID-19 and deaths by influenza and pneumonia. Now, one thing I do want to point out is this green banner here that has primary and secondary data. So this can alternate a little bit between what the primary data is. The primary data might be a crude rate, like it is in this particular case, or it could be a percentage, or it could just be a count. But we have kind of designated a primary data for each of these indicators based on what we think is probably going to be mostly useful for you guys when you're completing your IPLAN. So in this case, when you're looking at causes of death, we figured that a crude rate is probably going to be your most useful point of comparison to the state overall. However, if you're looking at this data and you really want to see like what's the actual number of deaths, you don't want the rate, you can always switch this over to secondary data, and this shows the actual count of deaths now. But I'm going to go ahead and keep it on primary data for the crude rate, because probably a lot of the time it's more useful. Now, lower down on this homepage, we've added a section to look at different demographic details. So if I go ahead and select deaths by influenza and pneumonia, I can look at the breakdown for this by sex and look at male and female. I can break it down by age group and see how the deaths by influenza and pneumonia are spread across age. I can look at by ethnicity or race. And these are, again, because I left this on primary data, this is showing, again, the crude rate of deaths for Hispanic and non-Hispanic populations, not just the raw count of data. And we also have for ethnicity. Now, our ethnicity or our race in IQuery is like the old IQuery website, still broken up by Black, white, and other, simply because the population of other races in some of our geographies is very, very small. And, if you've created a graph on here and you want to put that graph that image into your iPlan because you like the image, it can be downloaded as, you know, a PNG or a PDF or a PowerPoint or even an Excel.
Oh, awesome.
So yeah, this home is a great way to access the data we've got here and to visualize it. The custom chart tab is another function here where if you're trying to create something very specific that you've noticed in terms of a graph, you can use this to, in particular, this is useful if you want to have race and ethnicity together on one graph. So for instance, I'm going to leave this on infectious diseases and death. We'll go ahead and select influenza again. I'll pick an area. Let's just say Adams because it's there at the top. Pick a year. Leave it on primary because I like the rates. And let's break the data out by ethnicity. So we've got, oh, maybe I shouldn't have picked Adams. Let's switch it to Illinois. So I actually have data in both columns. Yeah. And then let's say I want to, you can use this color by to select race. So now I can see race and ethnicity in these bars. Or likewise, I could have different bars for races and then color it by ethnicity. We've also got a couple dimensions here if you want to like stack dimensions on the graph. But this custom chart tool is just a way for you to, if you've got something specific that you're trying to graph or show for your IPLAN, you can kind of create some different graphs with the data this way. And then the last tab over here is the Trends tab. And this has the same header as the Home tab, except for we have demographic dropdowns here. So it's at its basis very, very similar to the LHD profiles that I started showing. However, let's say you wanted to look at the trends in just the Black population of a county, and you wanted to see how that population is trending. Now these graphs are showing just that population and the trend in influenza death for that. So you can break it out and look at those trends over time. And the LHD profile, you might have noticed it didn't have this banner that said primary and secondary data. The LHD profiles would only show you primary data. So if you want to look at the secondary data and see a trend line for that, you would have to come to this Trends tab and swap it over to secondary data. But here also, you can play with the year range that you want to show on the graph. You can show different areas like with any of the other pages on here if you want to do a comparison. Yep, and just like with all the other pages, you can download these graphs in a few different ways. And then the last tab here is the data home. And when I click on this, it looks very, very, very similar to the IPLAN data button. Now, the difference with the data home is that this has all data point. It's not really organized by the IPLAN data categories. And the reason we have this is because we actually do have a lot of death data for different causes of death that doesn't necessarily fit very well into those IPLAN data categories, or maybe it does fit one of them, but it's such a rare cause of death that there's not data for a lot of places for a lot of years. So if you've got a particular cause of death that you're looking for, and it's not part of the IPLAN data set, you would come to this data home to look at it. But other than that, the functionality of these three tabs at the top is the same. All right. I will go ahead now and see, do we have any questions?
I think the questions we had were answered by Frida and Joanne in the chat.
Okay.
I don't
Excellent.
know if this question was asked. How about ICBRFS round 7 data?
Yes. Okay, that's a great question. So the ICBRFSS data is not in iQuery. They have some very specific requirements for data suppression when they publish, and their data sets have a different structure than a lot of the data we have in here. And so while that is something that we are, as a department, looking into modernizing that and, you know, publishing that, it's not currently in the iQuery dashboard.
Great, thank you. I think those were all the questions. The rest have been answered in the chat.
Thank you, Anna. We'll have more time for Q&A at the end, I hope, as well. Frida, you're up again if you would like to unmute.
Can you see my screen?
I can, but I'm gonna share the slides. I made a couple minor
Okay.
adjustments, if you don't mind.
Okay.
I think I was sharing, but I think I'll try it again. Okay. There we go.
So in terms of, this is still the landing page of iQuery, and then we have this data, a related data section. And in this related data, what we don't have in iQuery, we believe we can get them from other links. So what we've done is we have a section in the iQuery where we've put in relevant data from different data sources. So we have data from the Illinois Department of Public Health, and then we also have data from external sources like CDC. We even have data related to at the city health dashboard level, you know, because we have some local health departments that are smaller than county. For instance, we have Oak Park, Skokie, Stickney, Evanston, Eastside Health District, and even Chicago. They are not county level. So we have data for Chicago, for city level. We even have data for kids, because kids are very important. So if for some reason you're looking for a related data and you don't find it in this list, which is also published on the website, please send us an email if you find another data source that is very relevant for creation of a community health needs assessment, and we've not put it on this list. This also is another growing list. So we have all sorts of data in here. So, and if we go online, you will see this list there too, and the links that connect you to the direct linkage. So our next section is related data. And for this one, I would really like to share my screen, because, you know, these are the different menus we have. We have the iQuery, the dashboard, related data, indicator, and now this is the share. So under the share, we have this database, and we have this dashboard. And for this section, permit me to share my screen so that it becomes more lively.
Sure.
If that would
Sure.
work better.
There you go.
Can you see my screen?
Yes. Yes,
Okay.
we can.
Yes, so it's the exact same screen. I'm online, I'm on the iQuery website, and I'm looking at the share section. And share simply means sharing health assessment results electronically. And these are identified health priorities by local health departments since for the past 30 years, you know, from 1994. So from 1994 to current, we've had 6 complete rounds of IPLAN submitted by all the local health departments to the Illinois Department of Public Health. And each round, you know, this is round 1 was 1994 to 98, round 2, 99 to 03, round so forth, and then round 6 from 2019 to 23. We are currently at round 7. So if you look at this share, we have all the local counts by health categories. And you see, these are the categories that local health departments submit. And then we have the priorities. This is the language that local health departments use to submit as their health priorities for their jurisdictions. So we can also look at it from as health regions. You know, you look at the drop down, it shows you the different health regions. Then you can also decide to look at what priorities were prevalent at this which round. So if I put it at round 6, or you can even look at it just at the local health. If you just want to look at your local health department, you have that option too. So if we look at just round 6 and all the local health department, that is the current round where all local health departments have submitted their priority, because each local health department is supposed to provide at least 3 priority health needs that they want to address during their 5 years before they become recertified as a bona fide local health department. So currently it shows that behavior and mental health was a priority by 85 local health departments in round 6. So if I just click on the behavior and mental health, it will show you where all those local health departments that chose behavioral health or substance use abuse as their problem. And if you click on each one, it shows you what priorities they chose during the round. For instance, if we look at Winnebago County, they had behavioral health and mental health, maternal and child health, violence prevention. So their category was behavioral and mental health, and social and structural. So it just depends on which category. So or you can come down here. If you want to see what behavioral and mental health was called by the different local health departments, they are all here. You know, different local health departments may use different terminologies, which mean the same thing, and they are all captured on this list. So if you want to see which local health departments picked up behavioral and mental health as a health priority during round 6, you can see all the local health departments listed right here. And we think this is very important because it shows, you know, some kind of partnership. What is my neighbor taking as, what is the nearby county considering as a priority? What is pending? So you can see the distribution. You see how if we just take substance abuse alone, it shows there's a cluster somewhere around here. So this is a very important section that we just created this year. And we're hoping that the local health departments will take advantage of this sharing health assessment results electronically. Thank you.
Thank you so much. I think we have one more slide for you or Joanne, and let me just share here for that. And then we'll go into the Q&A. Are you able to see the data access slide?
Yes. So briefly going over the data access, because it's already been addressed in the previous slides by my amazing peers. Just know that we're covering the House Bill 2039. Items have been sent to the administrators. So if there's any issues or concerns, the contact person is Amanda Fogelman. Data access changes are coming because there's going to be based off of different tier levels. As of right now, iQuery is currently, I believe, at tier level 1, but there's going to be different levels of tier coming out to be able to find which levels based off the suppression of data and our sensitivity of the data that is based available per your master data use agreement, and or also the reason that you may need that data.
Thank you. And I want to, we didn't get to see this slide earlier, so I just moved it here to recognize the team that's been working so hard to get you all of this data. And we are on to questions and answers. So does anybody have any questions that you didn't put in the chat? You can raise a hand and Samantha will unmute you. There any questions while we're waiting? We did have a couple that came in previously through another session, the IPLAN basics training rather. And one was, why is there a lag in data? Frida, do you want to take that one, or Anna?
Yes, I can do that. Or I can start and Anna can finish. Public health data are collected, tested, analyzed, and released following a complex process designed to ensure accuracy, clarity, and internal consistency. So data are released only after required approvals have been obtained. I don't know if Anna wants to add some more.
No, I don't think I have anything to add.
Okay.
But I maybe just that, once the data has been approved and, approved for publishing, we do tend to get it into iQuery pretty quickly thereafter.
Great. So another question, I know that you said this just got launched or live last night at midnight. So
Yes.
can people, if they have the master data use agreement signed and they have the Illinois.gov account, are they able to, after this webinar, jump in iQuery and explore?
Well, they should still send us an email to dph.iquery@illinois.gov. Everything else is open except for the dashboard. Even the share is open access, but the dashboard is not because the data has not been suppressed. But if you want to gain access, send us an email at dph.iquery@illinois.gov. And then if you already have an illinois.gov account, your name will be put in the list of those who can access the Tableau dashboard. But if you don't have it, we will try to create one through our Department of IT.
And then also, Frida, can you address the ones that amazing local health departments that have been are like ones that kind of help us through the process? Are they able to have full access to this dashboard, or do they really have to resubmit?
Oh, no, those already have direct access. If you were one of those who helped us test the system when we're working, I think we had like 6 local health departments. You can, and if you have signed them, if your department or administrator or the executive officer has signed your master data use agreement, you have direct access to the dashboard and everything on iQuery, even now.
All right. And I also want to address a question that came in earlier. What do you do? Do we have to redo an IPLAN now that new data is out, or different things like that? I am not a believer on duplication of work, and anyone, I don't want to cause any extra work to you all. So if you've already started on your IPLAN process, continue on with that. Just cite the source that you are using for your current round. And if you have any questions and or need help with data, and or items that we've mentioned quite a bit of times that our iQuery corresponding mailbox is open and available to you.
Great. Other questions?
Yeah, another question came in. If your local health department is smaller than a county, we are a town, often iQuery does not go down to our level, only the county. Are there any tips for smaller local health departments? So I may start the answer and then Anna may finish it. I know that the iQuery website has related data sources that include links to common relevant data sources that local health departments smaller than county, maybe let's say Evanston, Eastside Health District, Oak Park, Skokie, Stickney, can use to complete their community health needs assessment. For example, we have the city health dashboard categories align with those used in the county health rankings and roadmaps. I don't know if Anna wants to add more context. I know she did mention it, but.
Yeah, so in addition to those supplemental data sources, we are planning on having data for all of the sub-county LHDs in iQuery proper. We've already gotten a few different data sets prepared and even uploaded and available into iQuery right now for that. Like the infectious disease, sexually transmitted infections, currently have data uploaded for all of the sub-county LHDs. We're in the process of creating the data files for all of the other indicators. There's going to be a few data points where we won't be able to provide data for every single sub-county LHD. Like in particular, median income, we probably won't be able to provide for LHDs like Eastside because they are made of multiple census places. But with just a few exceptions like that, we are planning on having data, the complete data set for every sub-county LHD.
Thank you. I know we are nearing the end of our time and we want to make sure we have an opportunity to hear feedback from you. Samantha is putting a link in the chat and you can give us your feedback on this session. So please take just a couple minutes to do that. And while you're opening that and accessing that in the chat, I would like to thank Joanne, Dr. Folcom, and Anna for their great work in putting this together and sharing this with you. It's exciting to have iQuery back and up to, getting up to date and have this resource available. So the data modernization efforts are really appreciated in Illinois. So we're excited about that. If there are other questions that you have, feel free to put them in the chat or email, and we will share the responses. You might see them in the frequently asked questions, or we will for sure send them back out to everyone with the slides and the recording of this webinar. Thank you so much for joining today. We do have a session coming up in October, training on integrating racial equity into the IPLAN process, into your community health assessment and community health improvement plan. And if you're not registered for that, you can register through the same mechanism that you registered for today. We also have a quality improvement training coming up in November, and we're working on a topic that you all would like to dig into more for the technical assistance session. So if there's anything that you're hoping to dig into more, please let us know. And this concludes today's session. So thank you, everyone. Appreciate your participation.
Thank you so much.
Thank you.
And make light work.
Great. Thank y'all. Have a great day.
Thank you.